Good morning and welcome back to my channel. In primary care, a key part of our work is the early detection and referral of suspected cancers. With the recent transition to digital triage, patients now have greater freedom to describe their symptoms, and our responsibility is to identify any high risk patterns in their descriptions that could indicate significant illness such as cancer. So in this video, I've put together a list of each cancer type, and for each you can see what stage 1 or stage 2 of an early cancer might feel like for the person affected, and this is by no means exhaustive. By stage 1, we mean cancer that is small and remains confined to the primary organ, typically with no lymph node involvement and no distant metastasis. Stage 2, cancer has locally advanced. Here, the tumor has increased in size or invaded nearby tissues and may involve regional lymph nodes, but has not yet spread to other organs or other parts of the body. So let's go through the 2-week wait referral pathway, which covers most of the wide-ranging potential cancer types that we are likely to encounter in primary care. For head and neck or thyroid cancers, a stage 1 presentation would be a small lump in the mouth, throat, or neck, or the thyroid gland itself. Maybe there will be mild, persistent hoarseness of voice, a sore throat, or a painless neck lump. Patient would often have thought this may be an infection in the early stages. At stage 2, the lump is getting bigger or becoming more obvious. It might be symptoms of reporting difficulty swallowing or speaking, or that persistence of a sore throat. Still not noticed any other lump anywhere else in the body. When patients report this pattern, typically when you're triaging their complaint, you'll be thinking of head and neck thyroid cancers. Brain and central nervous system tumors. Presentation is usually mild and often with vague symptoms in the early stages. Symptoms like headaches that usually don't fully go away, slightly change of vision, balance, or concentration that are often ignored. As the disease progresses, more noticeable neurological changes will include confusion, memory lapses, weakness on one side, worsening headaches, and possibly report of seizures. For blood cancers, or what we call hematological cancers, these include diseases that are called leukemia, lymphomas, myelomas. A stage 1 symptom would include fatigue, feeling run down, maybe persistent swollen lymph nodes in the neck or armpits. By stage 2, you might notice more lymph nodes affecting the glands in the neck or in the groin, and more systemic symptoms like night sweats, weight loss, fever, but no organ spread at this point. Moving on, bone and soft tissue cancers are called sarcomas. Okay, patients will report a small lump in the soft tissue, maybe in the arm or in the leg, and maybe mild pain in the bone that's persistent, often mistaken for an injury. And by stage 2, the lump would have grown bigger, they feel firmer, or the bone pain persists. Maybe a visible swelling can be seen at this point, but obviously still localized to the area where they are reporting their pain or swelling. Childhood cancers, about 3 that are commonly we keep an eye out for are neuroblastomas, Wilms tumors, and retinoblastoma. These are often subtle in the beginning. In Wilms tumor, you might experience a child having a tummy swelling that's persistent. In retinoblastoma, you might notice an odd reflection in flashing lights, particularly during your 6-week baby check. or vague tiredness. By stage 2, as the child is growing, you might notice, swelling getting worse, child complaining of a lot of pain, poor vision if it's a retinoblastoma, or a very firm abnormal abdominal lump. For upper GI cancers, which include esophageal, stomach, liver, gallbladder, or pancreas, at stage 1, the patient will be reporting slight swallowing difficulty, indigestion, vague upper abdominal discomforts, or mild jaundice, which we often mistake for maybe reflux or IBS, which is irritable bowel syndrome. By stage 2, symptoms have become more persistent, and patients might report food sticking more regularly, unexplained weight loss, worsening abdominal pain, or more obvious jaundice. Going down the lower GI tract, and these are colorectal or anal cancers, occasionally they might report rectal bleeding or small changes in their bowel habits, maybe slightly more looser or more frequent. And easily may put this down to piles, especially in a young person. By stage 2, bleeding becomes more persistent or frequent, and stools are clearly altered, thinner, more persistent change. There may also be abdominal cramps or feeling of incomplete emptying of the bowel. This type of pattern will usually prompt you to think about lower GI cancers. Breast cancer is another one that you might see on the triage. Most women would report a small firm lump that's usually painless, noticed by self-checking or during their own screening. There may be no visible changes in the skin or in the nipple. By stage 2, the lump may have become bigger, or additional small lumps might be noticed in the armpit. Possible subtle dimpling of the skin or nipple inversion might also be reported. In lung and pleural cancer, stage 1 presentation might be a lingering cough more than 3 weeks, slight cough, slight shortness of breath, or chest discomfort, especially in people who smoke. It's easy to put this down to just smoking or COPD or asthma. But if there's reports of persistent coughing with maybe streaks of blood, more breathlessness, unexplained fatigue, or mild weight loss, you should start thinking about bringing this patient in for assessment for possible lung or pleural cancer. Skin cancers, 3 major ones are melanomas, squamous cell carcinoma, or basal cell carcinoma. And in stage 1, patients may report mole changing slightly, becoming darker, irregular edges, or a new spot. By stage 2, the moles are thicker, it may itch, it may bleed, it may ulcerate, but evidently no distant symptoms to worry about, like glands swelling up or things like that. In urological cancers, we cover cancers of the bladder, prostate, testicle, and penile cancers as well. In the bladder, a patient might report blood in the urine once. Often we treat this as infection at the first presentation, but if there's blood in the urine after treatment of a UTI, it needs reviewing for possibility of something more sinister. Prostate in its early stages usually don't have any symptoms, but you may see a raised PSA on the blood test. And as the prostate enlarges, the patient may report prostate-related lower urinary tract symptoms like trouble starting or stopping urination, more frequent urination, blood in the urine, back pain, or erectile dysfunction may have also developed. Kidney cancers usually present late, but an initial symptom might be a small lump that may be picked up incidentally on a scan. Patient might report dragging sensation in their back on the flank areas that's radiating into the legs, or maybe blood in the urine. Testicular cancers, patient might feel a small painless lump in the testicle, or the testicle feels heavier or more obvious. Typically, they would request a male doctor to examine them. Penile cancers, if the patient is reporting a small sore or change in their foreskin, or ulcer that has not healed, or a discharge that is persistent, is worth considering reviewing them for possible, usually maybe an infection, but also look think about cancers. Gynecological cancers like ovarian, endometrial, cervical, vulval, or vaginal cancers, all these present in varied different ways, but it's important to establish the early patterns that you might notice. For ovarian cancer, occasional bloating, tummy discomfort can be mistaken as indigestion, but with bloating becoming more frequent or regular, clothes feeling more tighter, pelvic discomfort is what considering reviewing the patient. Typically, we request for a blood test that's called CA125, or if on examination there are signs of actual fluid in the belly, we refer you what we call ascites. We refer the patient for ultrasound. Endometrial cancers usually present as light spotting, usually after menopause, or regular postmenopausal bleeding, or even heavier bleeding than normal in somebody who menstruates. Cervical cancers may initially be picked up at a smear test, more noticeable bleeding after sex or between periods, or patients reporting increased vaginal discharge. Vulval or vaginal cancers, patient will report a small lump in the vulvar area, maybe a patch that's increasingly become irritable, itchy, or painful. The last but not the least group will be those who cannot fit into any specific category or system. Typically, they present with vague symptoms. If a patient is presenting with subtle tiredness, vague abdominal pain, unexplained mild weight loss, or describes any of these as more obvious or ongoing, things like appetite loss, night sweats, and weight loss, or multiple vague complaints without a clear cause, consider using your urgent appointments to facilitate a review. And if appropriate, you can refer these patients along the vague symptom cancer pathway after full investigation has failed to produce a diagnosis. I hope you found this helpful. Don't forget to like, share, and subscribe to the channel for more educational videos like this. Let me know in the comments how you re-stratify your patients after triage requests. See you in the next one.